then to open it up for questions. It's going to be impossible for me to answer all of your questions and address all of your concerns. I'm very happy to communicate directly with people afterward. And I understand that much of the information on the slides is complex. And so it is okay if you tune out the slides. Margaret and Pana have a copy. You all are welcome to distribute them and ask questions later. But I really wanted to focus a little bit on COVID management. Margaret asked me to mention vaccines and testing. And again, whatever questions you have, happy to take them in the time that we have. So again, this is my email. This is our on-call number. Although we should figure out, yeah, I don't see why you guys couldn't call our on-call number if there's questions. It's either me or my partner, Dr. Lazarus Lewis. And so we're kind of helping to move Santa Rosa Community Health toward treatment, which is really a paradigm shift. So I wanted to just start with yesterday's data. The county website has tons of great information. They update this nightly, and this is where we're at. You know this because your volunteers are growing, and that we're starting to surge here. And so yesterday there was over 300 cases, and so this is great information that gets updated daily. You also know that it is going to be a while before we reopen. That we are in the purple. We don't even measure. We're at 40.6 new cases a day per 100,000 people. That's double of the maximum on this chart. And so it will be quite some time before our society gets back to normal. But again, you can access this kind of information daily. It's updated. And I think it's a great place to go, the county website. You've got the link here. So I really want to congratulate you all. You all are doing the main work. And when I think about COVID, I think about these 4 waves, that there's an immediate first wave here in purple of people getting sick and dying, okay? And then most of those get better, and some people have some complications afterward. There's a constraint of resources, and then some people with diabetes and heart failure and asthma aren't getting the care that they need. But the bulk of what you all are dealing with is the mental health issues, the economic issues, the psychosocial issues, and that is just tremendous. And that burden is going to continue to grow. So I'm thrilled that there's new volunteers here today. And what my hope is I can get you to think about is, what could we do to lessen the impact of that first wave so that we don't have as much psychosocial and economic turmoil later on? Okay, so what I'm trying to introduce is the concept of giving people something that historically we haven't had much to offer, but I'm going to think about this, and you all are actually getting this before the providers in my organization and before most providers. So most people are not on this wavelength, but I thought it was really important to make sure that you all are up to speed. So in terms of treatment is available for outpatients before they get sick. We can monitor people. And I also want to encourage you all, as you're dealing with clients, to encourage them to be heroes and to donate their precious blood after they recover from coronavirus to help other people out. So the old paradigm is cross your fingers and pray that you don't get super sick and need to go to the hospital. All right. And so treatment is a paradigm shift. I'm a big fan of primary prevention. And if you do the math on an ounce of prevention is worth a pound of cure, that means that vaccines are 16 times as effective as treatment. So I don't want you to forget about vaccines and physical distancing and masks. And you all help provide the tools to enable people to quarantine and isolate. But I do think there is a role for treatment, even though it's probably less effective than the primary prevention. Okay. There's almost 600 different drugs in development from the FDA. There's hundreds of trials. We've only had 8 treatments approved or authorized under emergency use, and where there's only been 1 fully approved, that was remdesivir, and it's only for people sick enough to be in the hospital. Okay, so there's no currently approved FDA treatment for people before they get sick enough to be in the hospital. This is a list, bunch of fancy words for people that are sick in the hospital. What I want to focus mostly on is monoclonal antibodies. And then there are 2 vaccines that have been approved for emergency use last month, and we'll talk about them being rolled out. But this is called emergency use authorization. We're in a public health emergency, and so we don't have full approval for any of these. We had emergency approval in May for remdesivir, and then full approval of that drug in October. So again, really my heart is all about primary prevention and getting vaccines to healthy people without infection. That's over here. But is there pre-exposure prophylaxis or post-exposure prophylaxis, something that we could give to people before they get symptoms? What I want to introduce you to is this idea of early treatment. So for people not needing oxygen, not in the hospital, there is treatment that seems to work and will be locally available soon. I don't think you all get involved with people, but just so you know, there is treatment for people in the hospital. That the current convalescent plasma is approved for people sick enough to be in the hospital, and remdesivir is for people in the hospital. And if you're really sick, steroids and some other immune modulators. So monoclonal antibodies, this is a cartoon of the spike protein on the coronavirus. And so the antibodies are just your immune system attaching onto there. And so they're naturally made. And the idea is that a monoclonal antibody will bind there and keep the virus from copying itself. Okay, so that's what an antibody is. It's based on what's naturally available in our bodies to fight off infections. There was a study that was published in October that shows basically monoclonal antibodies seem to work. That they keep people, if you give them to people who might be at risk for complications, it seems to keep people out of the emergency room or the hospital within the next month. So the most benefit is for people above 65 and or who are obese with a BMI or a body mass index above 35. I like to look at it this way. This is the same information. What it reminds me is all these green smiley faces are people that are going to do just fine no matter what with coronavirus. And then the two smiley faces overall, or the frowny faces, the red frowny faces, means they're going to get sick no matter what. But if we treat people overall that are candidates for monoclonal antibodies, we might make a difference in 4 out of 100 people here overall. And the sicker you are, the older you are, the more obese you are, the more medical risk factors, the more the benefit of monoclonal antibodies. Okay, so I think overall for people above 65 or people who are obese, we need to treat 10 people to have one of them get some benefit. So most people are not actually going to get benefit from this intervention, but some people will. And I don't know which smiley face your client is going to be. So I would say, hey, if it's available and they're within the window, let's go for it. So I don't think I'm going to dwell on the actual workflow. This will be more for the medical folks. I think what you need to know is time is of the essence. And so we'll skip over this. Oops. This is a risk calculator. Again, if you're nerdy like me, you could go to covid19risktools.com and you could put in somebody's medical risk, their demographics, and let you know, like, what are the chances that they're going to get sick? And to me, that might work in some way to your protocols of how frequently does that client need contact. Again, if they're young and healthy, maybe you don't need to touch them as frequently. But if they have diabetes and heart failure and asthma and cirrhosis and they're 75, maybe that's someone that needs a daily or twice a week phone call. I don't know what your protocols are, but just this is something to consider, I think more for Pana and Margaret and Aurora. So convalescent plasma has those same antibodies. This is just taking the blood from people that have had COVID and to think about treatment. Again, emergency use is approved for people sick enough to be in the hospital, but I don't think it actually works really well. I think it mostly works earlier in disease. And last week we had a study showing that it maybe cuts your risk in half of developing severe respiratory disease if it's given early. Okay, this is not a locally available treatment. The closest place where you can currently receive convalescent plasma is a research study in Stanford, or need to go to Los Angeles. So not available yet, but coming soon. Stay tuned. Remdesivir, which has been fully approved for treating really sick patients, is available locally through clinical research at St. Joe's. They're testing whether giving this intravenous medication for 3 days will help keep people out of the hospital. So again, there's complicated criteria, but just to know that the therapeutics are going to be improving over the next short period of time. So I'm dating myself with my Top Gun reference here, but it's really all about shortening the turnaround time from when somebody has symptoms to getting their results. And you all might have a role. You might know of family members or contacts more than the medical providers. And so if you have this awareness that there might be somebody that's connected to your client, and they are older or have medical frailty, to really think about that rapid turnaround time and to let them know to ask their doctor or their nurse practitioner or their physician's assistant or their nurse to say, hey, is it possible to get treatment? Okay, so but it's all about the sooner we can get people tested after diagnosis and the sooner we can get them those results, the sooner the better the treatment's likely to work. I don't know if you all get involved with this, I'm guessing not, but people that have partnership health plan can get free oxygen saturation monitors. So I just did want to remind you of that. Is that something you all do, Pana, or no? You're muted. No. Okay.
No,
so
but
again, you might be directing
great
people.
Reminder if somebody seems like they're getting sicker and having shortness of breath, it's a specific thing that their provider could order for them that could help them stay out of the hospital.
So again, the medical advisors will mostly do that, or you ask for help, or somebody seems short of breath. Just think about that. Like that's something that needs to be communicated back to the medical team. And just to know that there are free resources. So again, this is the hero part. These are awesome websites. If you, I think this would be a wonderful service. Again, ideally it would be done on the medical end, but again, let people know, like, as you're closing out their case, like, wow, you know what? You've been given the gift of surviving coronavirus. And now guess what? You can contribute, you can donate, just like donating blood. And the way to do that is, this is from Vitalent. This is our local agency that does blood donations. You go to their website, and the first thing that they say is, "Dear survivor, patients need your plasma." And you can schedule online, you can call them, and that certainly can be donated locally. So I think that would be a great, again, hopeful message that you can share with your clients, that they can, once they've beaten coronavirus themselves, and most people do, that they might be able to help other people out that might not be as fortunate as them. So I don't want to dwell on post-acute COVID, and I think I should be wrapping up pretty soon. There are some people that have symptoms for a really long time. And most of those people have fatigue or shortness of breath. There's a whole long list of symptoms. I think the main message is just that I see this as kind of an equally balanced issue, that you're working on social, financial, cultural support, and the medical folks are working on the comorbidities. But it's really the self-management, the medical management, we're all a team, and together we can help people out. And so again, I just want to really give you all strokes and feedback that it's so important, the work that you're doing. So a word briefly about vaccines and then testing, and then I'll open it up for questions. We are currently moving into phase 1B. So, and this information is on the Sonoma County website, that most healthcare workers and residents of skilled nursing facilities and staff there should have already gotten either their first or second dose, or should be scheduled. Starting next week, despite our governor announced on Wednesday that people 65 and up, and I think that's going to start next week. Logistics to be determined. I've heard rumors about an app statewide that will let people sign up, but I know there's a lot of demand for vaccine. And once we get through phase 1A and 1B, we'll move to 1C, which are people with chronic conditions and more essential workers and people 50 and up. And then the summertime, we'll be able to vaccinate people. There should be plentiful vaccine eventually. And it's going to be, go to your doctor's office and go to Safeway and CVS and Walgreens and go to these awesome, huge facilities at the fairgrounds and other places that are coordinated through public health. So yeah, vaccines, I've gotten my first dose, and most of the people I work with have either gotten their first or second dose. Also on the county website, you can get everything you need to know about testing, and this is updated regularly. There's multiple agencies that provide free testing or insurance reimbursed testing. There is PCR testing, which is the traditional way we've been using. That usually is taking 2 to 3 to 4 to 5 to 6 days to get those results of the throat swab or oral swab. And then there's rapid testing or antigen testing that get results within a few minutes. And I think many people are trying out. And so there's been a whole host of these rapid tests that have been approved recently. And so that will really help us shorten the turnaround time. Antibody testing or blood testing to find out if you've ever had coronavirus, really, as far as I know, is not really practical this time and not locally available. And I know a lot of people are curious. I don't think it has a whole lot of value at this point because we're still recommending vaccination even to people that have had coronavirus as soon as their symptoms are gone. So I do want to respect your time. I do want to leave time for questions. I mostly wanted to send a message of hope to the clients that you're working with, that there is treatment available and more will be coming soon. So I really appreciate your attention. I think I'll turn it back over to Aurora or to kind of moderate if there's any questions or thoughts.